Hi, everyone. My name is Mary Groot. I'm a clinical health psychologist and associate professor at Indiana University School of Medicine. And I'm here to talk with you and with Dr. Jay Hamm about the AADE practice paper on mental health and the relationship between mental health and diabetes.
Yeah, and I'm Jay Hamm. I'm a clinical psychologist with Eskenazi Health and the Midtown Community Mental Health Center. Mary and I were part of a team of authors that wrote this paper, and we just want to take a few minutes of your time today to talk over some of the highlights.
Great. So let's start first with how are diabetes and mental health related to one another? We have been learning for many years now, well over 25 years, that diabetes and depression, anxiety, and more recently, diabetes distress, as well as serious mental illness, come at higher rates for people with diabetes than we see in the general population. If we look at depression, for example, we know that 1 in 4 people with diabetes will experience elevated rates of depression at some point in their lifetime. And when clinical depression is at play, which occurs in 1 in 8 people, we find that the amount of time that people are depressed is much longer in people with diabetes than we see in the general population. And so our practice paper provides some resources with appropriate assessment tools and referral sources for both anxiety, depression, as well as diabetes distress and SMI, so that when we encounter these presentations in practice, we have some tools to work with them.
There are also links between diabetes and cognitive impairments. So both type 1 and 2 diabetes are associated with cognitive dysfunction in older adults, with cognitive decline developing earlier in those with diabetes than in the general population. Some of the risk factors for this would be vascular disease, as well as poor glycemic control and hyperinsulinemia. In the paper, there are some specific strategies outlined to help address these needs for those individuals with diabetes.
We also know that food plays a prominent role in the management of diabetes, and decision-making around food is highly idiopathic. That is, that it's unusual. The kinds of decisions and awareness that people with diabetes need to have in order to manage diabetes has implications for people's relationship with food. And so that affects needing to eat even when one doesn't have hunger cues, which can result in patterns of disordered eating behaviors. And for a small proportion, but a very meaningful proportion of people with diabetes, that can result in eating disorders. And so the treatment for disordered eating behavior should involve diabetes educators addressing gaps in education and examining aspects of the treatment regimen that may be contributing to disordered eating. The practice paper can help diabetes educators to direct them to the appropriate resources related to disordered eating, as well as psychiatric eating disorders.
The paper also addresses some links between diabetes and serious mental illness. When we say serious mental illness, we mean diagnoses like schizophrenia spectrum disorders, bipolar disorder, or severe major depressive disorder. It's long been the case that people diagnosed with these conditions experience reduced life expectancy up to 10 to 25 years shorter than the general population. These concerning disparities have actually perhaps changed over time what's driving them, with the current number one factor accounting for the reduced life expectancy being much higher rates and poor outcomes of cardiometabolic disease. Our practice paper addresses how to collaborate in the treatment of cardiometabolic disease with individuals who may have persistent psychiatric symptoms, and also try to offer some strategies for communication to help diabetes educators feel more confident when working with people that might be experiencing some of these symptoms.
Right. Diabetes educators are familiar with a variety of burdens that are associated with diabetes and self-management. And a newer concept that has come into our understanding of the psychosocial experience of diabetes is that of diabetes distress, or sometimes referred to as diabetes burnout. We know now that upwards to 18 to 45% of people with either type 1 or type 2 diabetes are experiencing high levels of diabetes distress at any given time. And we know that diabetes distress has a linear relationship with higher A1C. So higher diabetes distress goes with higher A1C. So it's very important for diabetes educators to routinely administer assessments for diabetes distress, to listen for diabetes distress in their patients, especially for those patients who are not meeting their individualized goals or who are experiencing diabetes-related complications. The practice paper provides helpful assessment tools and suggestions for appropriate referrals and helpful management for someone who's experiencing diabetes distress or burnout.
The stigma of mental illness is another major concern. Stigma exists in all quarters of society, including in healthcare providers and in patients. And given some of the unfounded negative ideas or beliefs about mental illness, as well as the somewhat related issue of unequal provision of quality of healthcare, it's really important for diabetes educators to engage in practice day to day that attempts to combat or minimize the negative impact of stigma. Again, communication with individuals about mental health concerns or finding non-stigmatizing ways to work with people that may be experiencing serious mental illness or may have incorporated some kind of self-stigmatizing ideas in their own life and their approach to healthcare is essential. And that is also something that we try to address in the paper.
Great. So today we've given you a glimpse of AADE's newest practice paper on practical approaches to mental health for the diabetes educator. We hope you'll also read the practice paper in its entirety and share the paper with others in your network. Go to diabeteseducator.org/mental health to find this practice paper along with additional helpful mental health resources. Thanks so much for taking the time to listen to us today. Have a good one.